Oke, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Well, here I'm Alin Nurani Sulfani, and I'm a moderator from Group 11. Well, here my members are Sala Fira Septiani and Nawiro. So, today we will discuss about human processing and human brain. Okay, first material that I want to share this about the link between language and brain. So first, definition language. Language is one unique cognitive system that can be manipulated by humans to produce an infinite number of linguistic sentences based on limited elements used by humans as a means of communicating and accumulating science. According to Weizsäcker in Cahyana Bambang Yudi 1995, and then determining certain areas of the brain in relation to that language is based on three principal evidence. The first evidence is that language skills do not occupy the same part of the brain. Language skills, speaking, listening, reading, and writing, and linguistic structure, characteristic of syntax and semantics. Lexical and grammatical forms have distinct areas of the brain. Second evidence is that the language of all people occupies the same area of the brain. The third evidence is that there is a link between language skill and brain hemisphere. Okay, next explanation will be explained by my partner.
Thank you for moderator. Okay, I will explain about neuro-linguistic programming. Neuro-linguistic programming is one way that enables a person to chart all the processes that occur in his brain by programming his neurofunction by using language or his brain so that individuals can change the outside aspect of his life by changing the attitudes that are on their mind. Neuro-linguistic aims as follows. First, these express the purpose of neurolinguistics. Among them is to help humans better communicate with themselves, to reduce fear without cause, to control negative emotion, stress, and anxiety. Secondly, the neurolinguistic helps humans create positive goals for their future, helping to formulate specific goals and plans that will guide them to a better future. Third, when used in educational practice, the neurolinguistic will do much good to reduce the anxiety, insecurity, and high stress index that learners have for teaching learning. Fourth, for educated people, the neurolinguistic will also be able to help teachers grow confidence as someone who has to look good in front of learners. Okay, next, I will explain about the introduction of the first language. The acquisition of first language, or what is often called mother tongue, is a creative process in which the inherent rules of language are learned by the input retrieved from the simplest form to the most complex. The introduction of language in a newborn child is a form of crying that responds to the stimuli of its environment. His response grows with his mental maturity. Next time, the child will continue to store linguistic stimulants in its memory. The language is more rapid if the child is at least prepared in his golden age or at the critical age of critical 15. According to Lernberg, at a time when the human brain was still so resilient that it enabled a child to acquire the first language easily and quickly. As for the age of puberty, cognitive maturity has been achieved by the completion of certain cognitive functions of the brain, particularly the cerebral ones that become settled on the left-hand side of the brain.
Thanks for moderator. Second and third language acquisition. The acquisition of language other than the first language or language is called the second language, third, and so on. In general, there are two opinions about the acquisition of second language. First, children from birth have been accustomed to being exposed with various languages. Second, children learn second language after maternal language can be said well. Those two opinions are as good. They still have shortcomings. The first method can result in the emergence of delays in speaking because the child's brain works hard mapping what language is used by people who invite them to speak. But this does not last long. When the child is single, the ability will be honed by itself. The second method result in the second language pronunciation will be worse than children with the first method. Language disorders. Both the inability and lack of language inability that is interpreted as permanent and temporary speaking disorders can be categorized into three types. The first category example above is experienced by a deaf, blind, and person with a disorder of the mechanisms of speaking. Organistic imperfection causes deaf education to be prioritized to teaching language teaching by using six language as a mother tongue. Deaf then understand oral language and write as a second language. In the second category, language disorders occur because of the problem of cognition. This happens to people who are senile, dementia, schizophrenia, and depressive people. In dementia sufferers, the problem of thinking causes verbal experience to be colored by difficulties finding the right words. In the third category, children can experience linguistic language disorders, namely inability in the acquisition and processing of linguistic information. For example, the problem of fluency that occurs in stuttering and later children or in patients with physiological disorders concerning the error of information of formation and processing of articulation organs, such as the mouth, tongue, sailing, the base of the throat, etc.
Okay guys, now we are going to the last agenda. So here the conclusion. From the explanation above, it can be shown that communication skill are supported by the processing of acquiring language skill. This process is called neuro-linguistic programming, which is a model that programs the interaction between thought and language, verbal and non-verbal, so that it can be produced as pattern, thought, and behavior. The complexity of language demands a continuous accumulation of gain from the simplest level, which requires a combination of language skill and social skill. Well, thank you so much for you all for watching our video or material from this video. And last we say, wassalamualaikum warahmatullahi wabarakatuh.